She was born December 16th. She was a big surprise to us because I had had 7 miscarriages already. We were thrilled and named her Nisa, which means miracle. I started feeling poorly right around Christmas time. As the days went on, I just felt worse and worse. January 4th, we went in to the doctor's office. He's like, Allana, I'm not sure what's going on, but I want you to go to the hospital right now.
They brought the hematologist in, and he had looked at the blood work, and he walked through the door with tears in his eyes, and you know, that's not a good sign. And so he said, I'm sorry to say, Allana has leukemia. Everything
just stops. Like, you can't even hear anything. I just stared down at Nisa going, oh my gosh, how are we gonna do this? You know, she was only 19 days old.
She was diagnosed with acute lymphocytic leukemia. The specific type is Philadelphia chromosome positive, ALL. The best cure for this disease really is with a bone marrow transplant.
When we approached the clinic about treatment, the clinic's policy on the cancer ward is no kids under 18.
The normal policy regarding children is that they can visit during the day. We don't allow minors to stay overnight. And we had to kind of look at, you know, bending the rules for her.
With the baby being such a newborn, we felt that that was going to be important for the bonding, and she really was very reluctant, and I couldn't blame her to be treated unless she could have the baby with her. I think any mother would feel that way.
We talked about what some of the challenges might be in being able to have her husband and her baby stay with her, and really tried to weigh the benefits and the risks for the patient and the family and how we could best handle this situation. And we decided that it was so important to her healing and coping process to have her husband nearby, but also her newborn baby.
The clinic was amazing to do everything that they could to make that situation work.
We called Zora, who's from housekeeping, to ask her if she knew where we could get a crib from or a bassinet, and she knew right away where to find one, and she went down and did her magic.
So I cleaned the room, went and got the crib, set the crib up for her and everything.
They managed to find an isolette and stocked it with little baby stuff. We had play mat and a little rocker and then a pull-out chair where I slept. We were very fortunate.
I walked in one day and they were both sound asleep, chest to chest. That was the moment I said I knew we made the right choice.
The way that the floor pulled together and to make our experience wonderful impacted not only Allana's recovery, but Nisa's childhood.
She needed me as much as I needed her. I'm so thankful that they were willing.
And I'm going to be able to tell her, we're going to be able to tell Nisa, you know, how amazing the people at the Cleveland Clinic were to her.
Allana's story was everybody working together. There's so many things that the patients and the families go through. You have to think about what's right for that individual patient. You have to sometimes think outside the box. It is just a perfect example of putting patients first.